one of the biggest issues that's being considered this year is healthcare reform. And that really is a huge issue, and it's going to have a lot to do with the future fiscal health of the nation, because rising healthcare costs is really one of the primary driving factors when people talk about an unsustainable budget outlook. So it's really important that cost control be an important part of healthcare debate. We have to do a better job of controlling costs with healthcare even as we expand coverage. And I guess the good news in that regard is that there's lots of evidence that we spend more than we need to in our healthcare system, and there are opportunities for cost savings that would not adversely affect healthcare outcomes. But getting at those results is going to be difficult, and it's going to require some changes in patient expectations and physician practices. But I think if we all examine the evidence here and think about the trade-offs, we'll be able to arrive at some good solutions. What we can't do is simply add new commitments, new benefits onto the package that we already have and not worry about cost, because we're already on an unsustainable course. So we've got a double problem here. We need to pay for what we do in terms of new commitments, but we also need to make sufficient cost savings to bring down the current trajectory of growth even before we add new benefits. So let's worry about two things. Let's worry about covering more people, because I think that's an important public policy goal, but it's also important that we have an affordable system, because if we don't have an affordable system, let's face it, it's not going to be a very sustainable system, and that's not going to add to anybody's long-term security.